Hi, I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner and a chiropractor.
Dr. Randall Yates, board certified chiropractic neurologist, also a chiropractor.
And today we're going to be speaking about the rise in the incidence of autoimmune disease. And this is a topic that has come up many times this past week and a half in the office. And maybe it's because some well-known performers have developed autoimmune diseases that have stopped their touring. Lady Gaga, I think, is, and another one I think is Selena Gomez, if I'm not mistaken. And in reading the newspaper articles on them, they're quite sensational. I don't know what they're doing. I don't know how they're going about it. But autoimmunity is something we feel like we have the ability to discuss with both research data, but more from clinical experience as to what's going on. I have been asked this question like 5 times in the last 6 or 7 days by people who have come in for consults. So we're going to hit kind of the research element of it. We're going to also hit kind of what we see, kind of the more of the practical clinical element of it. And we've been doing autoimmunity for a long time. Yeah, a long time, 8, 9 years, 9 years for 8 years, 9 years. And, but that's what we do. Basically, we do chronic pain. Dr. Gates is a board certified functional neurologist. For those of you who haven't watched this, I'm a certified functional medicine practitioner. And we found that we needed both of these elements to be able to produce the types of results that we wanted to be getting. We need these chronic diseases are basic, like fibromyalgia, peripheral neuropathy, chronic fatigue, or pretty much anything that's chronic. Chronic migraines that won't go away. There's certain specific elements to them. They mostly have multiple vicious cycles going on among different organ systems, as well as maybe different biochemical pathways. And so that paradigm is one that needs to be embraced by the clinician to be able to help you if you have these things. We've seen that one of the key factors to this explosion of chronic disease, and it's not the only factor, but one of the key factors to this explosion is autoimmunity. And we did not understand when we got into this that that's what we were going to see with the breadth of with which you see it. It is a rare person walks in here with the types of problems that are attracted to this clinic that does not have a confirmed or probable autoimmune problem to be confirmed who walks in the door. Sure. My mentor, Dr. Crosby, kind of told me that was going to be the case years and years ago, and I did not believe him. This was after he helped me. I have Hashimoto's, I have celiac, I probably have antibodies to my cerebellum, and so I've had this happen. After helping me, after going through these things and understanding that autoimmunity was an issue and it could be dampened and controlled and things of that nature, I still couldn't embrace that. I still couldn't embrace that there was this quote unquote from Dr. Crosby, this explosion. There was going to be, this is what he said, an explosion of autoimmunity that's going to create chronic problems in this country and maybe beyond. Well, 9 years later, if our experience is correct, he was correct. And so we've done thousands and thousands and thousands and thousands, and I'm not exaggerating, of consults on these matters. So I kind of have a feel for what I believe and understand it to be. But my beliefs and understandings aren't as well documented as the research yet. I might give it a little bit more credence than the research, but we're going to cover both sides of that. And so Dr. Gates is chomping at the bit here to help you. This is important because people are coming in and are going, what is happening? What is happening? You know, we're like in the 3rd generation, like the mom had it, the daughter has it, the daughter sitting there realizing that maybe their daughter has it. We saw the patterns long ago. If somebody has an autoimmune thyroid problem and they were a female, that if their mom had it, their daughter was probably going to, and things of this nature. It is a big deal. This is a big problem. And it's a big contributor to the chronic conditions that we treat. Why is it happening? Okay, so why is it happening? Why don't you go ahead and give the research aspects of it. And if you want to delve into some of the more practical things that we've seen, that's fine. Mm-hmm. And then I can, if there's anything left, I can do that.
Well, it's really a multifaceted problem.
It's
that's
majorly multifaceted.
Kind of hard to open up. Yes, there are genetic associations to autoimmune disease, quite certainly. Autoimmune thyroid disease is one of the best examples of that. But then on top of that, it seems like the epigenetics are affecting people even more. So now we're seeing person after person after person being diagnosed with autoimmune thyroid disease as an example. And we're also getting more information regarding just the autoimmune condition by itself, independent of the organ-specific involvement. So thyroid problems are a good example of that. So most people know if their grandma had a thyroid issue because their grandma had to take thyroid hormone.
Or get a thyroid out, or have a goiter.
Exactly. Yeah. But most people don't know what their grandma's autoimmune titers to the thyroid really were. And so with the popularization of laboratory testing and people really wanting to investigate those parameters, we're seeing that more and more people are getting an awareness of their autoimmune diseases. That's number one. Number two are clinical criteria. So for example, we'll just use the thyroid because it's the most common autoimmune disease in this country. It affects primarily women, and it's just a great example. So for example, the immune count to the thyroid, for it to be high, used to be over 100. And then that went to around 60 when I got into practice. And then it went to 34, and then it went to 20 with some labs. Now the Mayo Clinic says 9. Our local hospital says 9. Most labs in California say 9. In Europe, they're saying 5.5. So there is a discrepancy in terms of what actually constitutes an autoimmune disease and what does not. Now in the literature, they talk about that as being part of the reason why possibly some of the statistics are so increased. I'm not going to say inflated, but they're increased. Aware
that people have
exactly compared to what they used to be before.
But now we're finding out that they have.
But then we could use conditions such as autism, which are confirmed as an autoimmune condition, and autism is absolutely exploding. We also know that a host of other metabolic diseases like prediabetes, diabetes, obesity, when you're just basically overweight, are also exploding. So now 2/3 of the US population has a weight problem. And that wasn't the case 50 years ago. So there seems to be societal factors at play also. Now that brings up, well, what has changed in our diet? Why are people so overweight? Why are there so many autoimmune diseases? And that sparks the controversy of gluten. So many researchers now are talking about the hybridization of wheat in this country, how it's been changed to become more resistant to the elements. And with that, it's harder for the human gastrointestinal tract to break it down. It's now confirmed that gluten is a toxin for the proteins that bind each intestinal cell together. And that opens up this Pandora's box of leaky gut, which is extremely controversial. Go watch our broadcast on it. Look at the 110 references we attached to that broadcast because it's much more voluminous than the Wikipedia article on the topic. But needless to say, this concept of leaky gut is now being associated with almost every autoimmune disease, at least as a propagating factor, if not the instigating factor of the illness. So
I think
all these factors
saying that all autoimmune disease comes from like leaky gut eventually.
I think eventually, I think especially if they can create a drug to combat it. But I think that's probably what you're going to see. And so now I was just writing down a few conditions before the broadcast, but autoimmune disease is so far reaching, and most of you wouldn't even think of a lot of these conditions that I'm going to list as being autoimmune. Like fibromyalgia now is pretty much an autoimmune condition. We cited an article earlier this year, is February of 2017, where they took a group of Hashimoto's patients, that's where the immune system kills the thyroid, 62% had fibromyalgia. And then when you look at the other statistics, most of the time, let me say it this way, 50% of fibromyalgia patients have peripheral neuropathy. Most of the time when they have peripheral neuropathy, it's due to the immune system killing the peripheral nerves. So you have fibromyalgia. Schizophrenia, who would think that schizophrenia would have an autoimmune component, but now it's tied in the literature that there's a significant association between food antibodies and something like schizophrenia. Bipolar disorder has associations to autoimmunity. Polycystic ovarian syndrome does. Meniere's disease, like we've talked about. It goes on and on and on and on. Yeah. And the previous research used to say that 1 out of 6 individuals in this country had an autoimmune disease, but now with the shifting of the criteria and more awareness, and the awareness that the immune counts, for example, to the target organ by themselves can create a lot of symptoms, now we see 1 out of 3 females has autoimmune thyroid disease. and then you lump up all these other conditions on top of it, I wouldn't be surprised if it's really about 40% of the population that has an autoimmune disease, and you're going to see that come out eventually.
Well, the Centers for Disease Control just said that about 40% of the population has chronic
pain,
right, and chronic conditions, and that's what we do. That's who shows up here. That's what we see, and it is a rare person who walks in here who does not have an autoimmune problem. And so it's probably like, there's probably two things that are the flies in the ointment, and that this is one of the two major things.
Mm-hmm. Now, you've been in practice for 30 plus years, longer than I've been alive. What's your observations?
38 years.
Exactly. In terms of, I'm 36 now.
What are you trying to say? My gray hair shows up better against our new black.
Well, your experience, would you say that you're seeing a sicker population? I mean, you work with thousands of chronic pain patients.
I got interested in chronic pain about 1987, and I was practicing chiropractic, and it was really kind of just odd. It was like I'd have all these patients who came in, and they were terrified to go to the chiropractor, and he was going to kill them, and all of a sudden they started feeling better. And next thing you know, I was like, whoa, why does everybody hate you guys? It's great. And then I had those patients that weren't like that, and not only did they not get better, but sometimes they would get worse. But doing the same evaluation on all those patients, it was seemingly like no difference musculoskeletal among these patients. So we experimented with diet, and I had one patient who came in and wasn't doing very well after a car accident, and then disappeared and came back 6 months later, lost 60 pounds, her inflammation was gone, her neck was better. And a colleague of mine in town who was a kind of a alternative medical doctor, MD-ish doctor, took her off a wheat. It's like 1983. I'm like, he took you off wheat and all this happened? And she was like, yeah. And I'm like, yeah, right. So, but it, it kind of raised the awareness. We'd put people on blood sugar diets, and a lot of them would feel better, and their headaches would get better, and their lightheadedness would get better, which was supposed to get better. Anyway, making a long story short, somewhere around 1997, I thought, okay, all these people that I would come in for acute problems, and I would treat them like 3 times, and then they would feel better. And then the next time they came in a year later, then I would treat them like 8 times, and they would feel better. And then a couple years later, I treated them like 21 times, and they would feel better. And then about 7 years later, nothing made them feel better. So started looking into the musculoskeletal aspects of chronic pain. But it was always apparent that the people who were not responding were also stressed. It was very apparent. They were stressed. They were getting divorced. They were going through a bad problem. Something was going on. And it was like, well, there's nothing I can do about that. So you just got to go home, get unstressed, whatever happens, and then come back later. Years later, we find that this chronic stress cycle is also a big problem going on with this. But that was an aha. The weight thing was an aha. The blood sugar diets were an aha. And it's interesting in looking at the patient population now, that the big keys that we see, and we've talked about this a million times, is autoimmunity, gut, thyroid, and stress. But we're talking like chronic stress responses, like emotional trauma, like people who've had emotional trauma. Maybe they've been sexually, physically, verbally abused. Maybe they have, maybe they've been through a rough divorce. Maybe they were a kid and their parents went through divorce, or things of this nature that set them in an emotional trauma. Their brain went into stress response and it never got out. And you can watch, we have tons of videos on that. You can refer to those. But in the end, my observation, I do the consults here. Okay, I do the intakes. I try to make sure that a patient is properly qualified for a program. I help out with the evaluations, and I essentially report the findings and what we would do and how we would do it, and what the treatment would look like, and so on and so forth. So I get to hear the full histories. If you want to treat chronic pain, you need to do a full history, like from birth until where that person is. And so this is now look, I'm not moralizing here. Okay, I want you to know that this is purely objective data that we have observed. But since 1980, and sooner than that, in fact, that it started to kind of hit a roll back then. But we have a breakdown in the structures that have created kind of like a solid society. in my observation, okay, in my opinion. And I've seen this correlate with what's going on because there's stories every day. And so, I think it's, you look back, you see the breakdown of the family. The family is pretty nuclear. The kids had two parents. Even if the parents yelled and screamed at each other, and even if the dad was an alcoholic, usually there was an agreement you didn't get divorced, or at least you didn't get divorced till the kids were gone. Man, we have like a ton of stuff going on today with these kids coming in here stressed out of their minds in 3rd grade, in 8th grade. Now, there's more stuff going on today with these kids. All right. We can get into the antibiotics. I don't think anybody's going to disagree. We use too many antibiotics in this society for a long time. Kids get ear infections, you get them antibiotics. What breaks down the gut? The gut breaks down. Now you have this vicious cycle that takes place because now you start getting toxins, you start getting food sensitivities. Where do they find their way to? They find your way to their joints. Maybe they find your way to exacerbating your immune system, and they definitely find their way to your brain. All right. So now we get this. So we got this early vicious cycle going on. What do? The kid gets sick. We give him more. We give him more antibiotics for his gut. We have the issue of we have that issue, and the kids are stressed from the divorce. They think it's their fault. They think that it's they were the cause of it. Maybe they like their new stepmother or stepdad, and that doesn't go over very well. It's a very stressful situation. Now we have bullying. It's a big deal. We have bullying. We have someone here right now from out of the country, and I was talking about this yesterday to the mom. The mom said, "Could bullying do this?" I'm like, "Yeah, it's like in the top 5 probably, or 10 things that could do this." These create emotional traumas. We have an unstable situation going on. Now you got these kids with the cell phones who can be bullied on the cell phones. Okay. Now we have the distraction of the cell phone. We have poor socialization. This all affects brain function. It overstimulates the frontal lobe. That's my personal opinion, that our frontal lobes are not designed to handle and withstand the type of stimulation that we're getting thrown at it today. Now, when I first met Dr. Gates, and years ago, he said, it's also that everybody in this country is like in fear. Now, that was a generalization, okay? But his point was that we have the cell phones, that we have television, that we have a news cycle that's 24/7. Now you can't get away from it, even if you watch sports. It's crazy. Everything is politicized. No matter what side you're on, it is continually throwing stuff at people who maybe just take it a little bit too too much reality, and it stresses folks out. So we have this chronic stress cycle going on. We have these phones that are continually ringing. They're continually giving you updates from the sports game, whatever it is. They're continually asking for your attention. And there's studies on that now showing how it's altering brain function, how it's decreasing the attention span, how that's altering our ability to learn, and on and on and on and on. There are a lot of other things we can go into, but most people seem to cognite with the stress response being a big issue once we start delving into it in the consult. Okay. Right. Then the next thing that seems to go is why, and you're talking about why autoimmunity. Now you start breaking things down. The bad frontal lobe. Your frontal lobe is who you are. It's where you make your decisions. You're happy, you're sad, you're depressed, you're ecstatic, you're motivated, you're not motivated, all those types of things. But your frontal lobe is supposed to be dampening the stress response. As you've taught me, by the time a person's 19 to 24 years old, they don't have the ability to dampen that yet. Their frontal lobes have not been strong enough to do that. This is what's happening. And now what's happening is, in that society, in that massively stressed out society, and this is more than stress. I'm not saying you're stressed. I'm saying you guys are all, like the people who are in these chronic situations, for the most part, are in some sort of a low level or high level of fight-flight syndrome, a more polite word for it. Maybe you might want to call it post-traumatic stress syndrome, but their brains won't shut off. They can't go to sleep. They wake up, they can't go back to sleep. They have anxiety for no reason at all. Maybe they got night sweats, and then their doctors tell them they're going through menopause, and it's like, are you hot or are you sweating? I'm just sweating. It's the brain. Okay, so now you have all this stuff creating this in the population. Now mom has a kid. And now you've seen research that says the stress hormones cross the placenta. Dr. Gates just talked about a genetic propensity. All of this stuff goes to do what? I have seen articles that say stress responses affect virtually every cell in your system, and some more than others. And these stress hormones seem to have a propensity for certain things like like your sinus cavities and your lung cavities. But the big thing is your gut cavity. Now you can't eat gluten. Now you got hybridization. Now you got leaky gut. Now you got all these different types of things. My contention is, and it could be entirely wrong, but I would be betting on the body. My contention is this body was made and designed to be able to withstand stress and stimulation of normal type on planet Earth. But we have upped the game on the attacks on our frontal lobe. And these sinus areas and these lung areas and these gut areas, this is where lots of your immune system resides. And so now your immune system is compromised. So now you get a cold, you get a flu, you get a trauma, you get a surgery, your stress hormones go up 200 to 300%, or you get an overwhelming infection, your immune system is already kind of like compromised. You have a child and you have a shift in your immune response over to making lots of antibodies. Now mom's already got an autoimmune problem. And you have the propensity to get it. You're pregnant, you feel wonderful, you deliver the kid, and all of a sudden everything falls apart because you've now got an attack against your thyroid and your immune system has flared up. This is what I hear. I hear variations of this history every day. And there's more, but you kind of get the picture there. It's like he's probably filling in the blanks right now. He's got, like, I can see it. But there's more. I mean, that to me, that's the basic premise. And I will tell you, I've been in this a long time, as Dr. Gates said, not to re-emphasize that, but I've seen cycles of certain things that you could see coming like 10 years before. And because you saw it happening, but nobody embraced it because it was only 10 million people. Now the Centers for Disease Control says 130 some million people as of about a week or two that have chronic conditions. And they come into our office and the vast majority fit this pattern that I just got done talking about. And it's a pattern that I think we see.
So let me play devil's advocate on this and throw you a situation. Yeah. So what about people in your parents' generation who were in World War II? These guys are over in World War II, see the most atrocious things. And PTSD, at least at that time, was not documented as being nearly as common as it is today. Yeah. Some people are saying that's because maybe the guys who are soldiers today, when they grew up in more of a, tranquil, complacent environment. Life wasn't as rough for them, so to speak, as like your parents' generation, who when they were adolescents, they were going through the Great Depression, food was limited. So it was a much harsher life at that time.
Yeah.
I think you have a good perspective on that. So maybe if you could offer that kind of
I thought you were trying to fake me out.
No, I'm getting your opinion. And then juxtapose that to, even though maybe they went through those stressors, what was your parents' generation's daily life like compared to the daily life of the average American today who's sleeping 6 hours, blah, blah, blah? So,
yeah, there's twofold there. My dad was in World War II, actually fought for Patton. He was in the I won't get into all that, but he had shrapnel in his head his whole life, and if a firecracker went off, he ended up under a car. So he had massive post-traumatic stress syndrome, but people kind of understood that because it was post-World War II, and so many men were my uncles. My one uncle were on Fort Dix Air Force Base. I had another uncle that was fighting. These guys were over there for my dad was over there for 24, 26 months, straight fighting in wars with little breaks here and there. He was in Normandy, that whole thing. So, okay. So first of all, I mean, they got a lot of more support. It seems like since the Vietnam War, not to get political, okay, the support for that type of stuff is down. Maybe right, maybe wrong. I'm not going to make any judgments since I'm just saying this was a different time. They did go through the depression, and life was simpler then. Okay, was it better? I think it was better. Okay, but it wasn't perfect. But it was simpler then. We didn't have television. Okay, so I'm 65. So we didn't have television until later because we couldn't afford to have a television until later. So we didn't have all that. We lived in a city. We had stoops. We sat on the stoops. It got hot at night. We didn't have really air conditioning. So we all went outside and we sat there. And the next thing you know, all the neighbors were talking. The kids were playing. Which is better for your frontal lobe, right? Which is better for your brain, which is better for your physiology, not sitting in front of forget computers. I mean, there was nothing. And when we did get television, it was like 3 channels from like 6 o'clock in the morning to 11 o'clock at night. And then there was snow. We used to call it snow. Shh, that type of stuff. So you had that. It was just starting. The medications were just starting. My mother, unfortunately, was one who embraced there's going to be a pill for everything type of thing. By the way, she died a long, miserable death. And she wouldn't listen to me because I was a chiropractor, right? Like so many people. and she ended up with a lazy Susan of multiple drugs, for a drug for everything. But that started about in the 60s, really. That really started about in the 60s. But for the most part, people, the food was better. Okay, the food, but the stress levels were, there was, the 60s was racial strife and it was the civil rights and all that, but it was nothing like today. People could get away from it. Sundays, there was no stores open. No stores were open. Can you imagine that? There was no stores open on Sunday. Actually, from Saturday afternoon until Monday morning, there was no commercial stores open. People went to church. People went to church on Sunday. I lived in a Catholic neighborhood. I mean, we had this big cathedral. People went to church. On Sunday afternoon, maybe they went and picnic along the river. I mean, it's people go, oh, you want to go back to the 50s? Like, no, I don't know. I want to go back to the 50s. There's a lot of stuff I like about today. Okay. But we are out of control. We never stop. Usually by the time there wasn't 3 shifts of almost anything. Usually by the time people got home, that was it. They worked hard. They were done for the day. Maybe they sat in the backyard. They talked with their neighbor. If they went to a movie, there weren't that many movies. So they go to movies like, maybe if they were like big movie goers, maybe they went to a movie like once a month because new movies didn't come out very much. So there wasn't a lot of distraction. There was a lot, the movies, the television were a lot less. They were more this, say what you will, but there were happy endings. There wasn't the realism of people having their guts spread all over the place. There wasn't political discord when you were trying to get away from it. This is, I mean, this is not a political statement. This is not a judgmental statement. This is just an observation from someone who has walked through that whole thing from both sides. And I just got done saying to our guest here, who is sitting here watching, I just got done saying that. I just got done saying there's a coffee machine downstairs. And the doctor asked, and I said, I'm not big into gadgets. It's not because I'm stupid. It's not because I can't do it. It's just that I've seen a better way. There are times when it's good to have convenience, but we are nonstop 24 hours a day. We have things to do, things to watch, places to go. Now the kids have to go to 20, they have to be the soccer and then the ballet and then the song and then the this and then the that. And if they're not there, and we can't have one practice. We have to have 26 practices. I mean, it's like we're crazy in this sense. We have been, because we've been trained that this is the way to be, and I'm convinced that this has a lot to do with it. And so did I answer that question?
Mm-hmm.
Is that kind of what you were hoping to hear?
Yeah, because when I came into this, I was living in the Bay Area. And I think that was most representative of this problem.
And more so even now.
You get up, people wake up late, you got a big drive ahead of you because you're going to be in traffic, you're eating in the cars, you're stressed out, hoping that you're going to get to wherever you need to get to. You go all day long, you're drinking coffee all day long, and then you rush home. And you stay up way too late watching news about this murder after that murder. And it was a very negative cycle that I saw a lot of people in. And I think that's kind of, we're not trying to get political or on our soapbox, but we're just talking about stress as it pertains to autoimmune disease. And we feel that this is a big factor that a lot of people are not talking about. Is the food and the change to the food production in our country a factor? Most likely. Are we going to get into that? No, because there are enough people talking about it.
But it probably wouldn't be as big a factor
if people were not as stressed.
If we weren't flooding our system with stress hormones all day, damaging our gut and then creating a vulnerability to where our gut couldn't take care of these things.
Right, exactly. Because we treated patients from a metabolic standpoint only. We treated patients without addressing the stress component. And our results at that point were diminutive compared to what they are now, because our results are far exceeding where we were a few years ago by addressing the stress component. So I think that's everything I wanted to say. Was there anything else you wanted to put out there?
No, I mean, really, the thing is why is this happening? I think the two things is we've created this scenario that overstimulates our brain from so many different areas of society, breakdown of society, and then just pure stimulation. And then that exposes us to the ability to have our immune system compromised. And then that's being passed on through genetics and through the placenta. And it's kind of troubling. It's kind of a problem because it's hard to see it turning around, because of so many of the things that are being promoted to keep us stimulated are making billions of dollars for somebody, right? And so that's a problematic. And right now it seems like we're arguing more and more and more for the things that are breaking down society. This is not a moral thing. This is not a liberal versus conservative thing. We're arguing for more and more and more things that are breaking down the things that used to create a stable society that allowed us to have that cocoon to come home to. So those are the things that we see consistently. I think you're going to see that come out in the literature over the next several years. What we're going to do about it, I don't know. We know how to get you under control and dampen it, but we're a speck of sand. We're a speck of sand on the beach of life as far as being able to take that. I mean, we've been doing this for a while now, and every year the estimate of chronic pain and chronic conditions, which have a large base in autoimmunity, keep expanding. So I don't know, it's my plea to the world to we need to do something about this. And unfortunately, I don't see it happening right now because too many people seem to have a stake, the drug companies. No offense, drug companies, but there's a better way than Xanax and Prozacs and benzodiazepines and stuff like that. But really the best way is to get it back under control so that everybody and your grandmother doesn't need a drug to be able to calm their brain down. So that's really where we're at.
Yeah, I agree.
I think, my opinion, more opinion today than data.
And there's data. So if you want the research articles, we attach those. You can go to powerhealthtalk.com, go to the bottom of the page of this video. You'll see our research references for today. And if you have any topics you want us to discuss, please forward those to us. And otherwise, we'll see you next week for an exciting broadcast.